So this is the last component of today's symposium. So I just name it as a Pregnafit because there's a reason for that. My topic is to stay fit and active, especially the exercise during pregnancy, which is usually not very common topic. Usually we talk in symposium or any other forums with related to pregnancy. So anyway, this is not a new thing for many countries, but of course in Sri Lanka also there are some places where it's been practicing, but not very common. But anyway, we as sports medicine physicians now, the sports and exercise medicine is a new concept and new field. It's an emerging field. Now we have the fully qualified consultants and the senior registrars and the registrars and qualified medical officers, in many places in Sri Lanka now. And we are like in the limelight of, introducing new things as well as new things for our society, but it is not new things for many in the field of medicine. So when it's come to this topic, so I just wanted to, show this little information to you. And you can see here the Aisha Montana. She's the one of the US national runner, a champion female runner, who actually completed her track and field 800 meters when she was having the POG 34, right? So she actually, this was not only one time, because the two occasions she has done it in 2014 and 2017 as well. So you can imagine now, this is the the picture of the world when it's come to the exercise sports in relation to pregnancy. Now there are many scientific evidence when it's come to the benefits of exercise in pregnancy. Like you can see, the supervised program of moderate intensity exercises performed throughout pregnancy was associated with reduction of rate of cesarean sections, which was highly mentioned by Dr. Sampath Gnanaratne. So the incident of cesarean sections in Sri Lanka and some instrumental deliveries, of course, and especially when it's come to the healthy women in pregnancy. So it's obvious that it reduces the diabetes incidence in pregnancy. Of course, we have, during our applications in these exercises for pregnancy-induced hypertension, we got a very good results a couple of years back. I'll just show you later. And of course, there's no any risk of preterm delivery, because many people who fear to do or engage in exercises thinking that it will actually induce the preterm delivery. And of course, you can see with some of these very practical research has been done. And when somebody is performing about 43 minutes exercises per day, 3 times per week, at heart rate around, maintaining around 145, these are very objective measurements like they have done, and it does not appear any associated adverse effect for mother or fetus, right? So having said that, so there are some requirements actually for prescription of exercise in pregnancy. Exercise is a prescription, so it has to have a methodology. So we have the PP, or we call the PARQ, that is the physical activity readiness questionnaire, specially designed for pregnancy to assess the risk assessments and to assess physical capacity to engage in sports. So this is the standard physical activity readiness question in pregnancy. So you can see some of the, very simple questions. You don't need to have a kind of a big thorough assessment, but you just keep, we have already introduced into some of the units, just the medical officer or a person who assessing the pregnancy lady who's fit for these exercises, just go through and just see if there's any anomaly. We can actually go for the referrals or specific advice from the the relevant specialties. So anyway, based on that, we should know some of the contraindications and also the indications. So the absolute contraindications to exercise in pregnancy, as shown in this slide, you can see the ruptured membranes, premature labor, unexplained persistent vaginal bleeding, placenta previa, especially after 28 weeks of gestational, preeclampsia, incompetent cervix or cerclage, intrauterine growth restrictions, high order multiple pregnancy. Most of the time it's a triplets, but in twins it's not very, but we have the cautions to be done. Uncontrolled diabetes mellitus, hypertension, and uncontrolled thyroid, and other serious cardiovascular or respiratory or systemic illness depending on the case. So when it's come to the relative contraindications, so the recurrent pregnancy losses, it's a relative contraindication. Gestational hypertension, still we consider. History of spontaneous preterm birth, history of fetal growth retardation, and mild to moderate cardiovascular or respiratory diseases, symptomatic anemia, malnutrition, eating disorders, twin in pregnancy after 28 weeks. The symptomatic anemia is a bit of a controversy. Sometimes, depending on the exercise tolerance, like you can start very mild exercises, then while we treating the condition, actually we progress to standard practices. So twin pregnancy, still relative. Other significant medical conditions, poorly controlled seizures, still relative, still you can do. Morbid obesity, extreme underweights, especially BMI less than 12, orthopedic limitations are naturally contraindications depending on the case. And when you are doing any exercises, if the pregnant mother is having any of these symptoms or signs, it's a time to think of stopping these exercises, especially the abdominal pain, unexplained, amniotic fluid leakage, calf pain or swelling. So we have to rule out the thrombophlebitis, cervical enlargement, chest pain, decreased fetal movements, dizziness or pre-syncope, dyspnea before exertion, fatigue, headache, vaginal bleeding, painful uterine contraction, shortness of breath or preterm labor. So this is, having this knowledge, I mean, there are like standard prescription. I mean, this is the American College of Sports Medicine, which lay down the pregnancy physical activity protocols and guidance. So you can see the aerobic exercises, like we usually uh, nominate as the aerobic or the cardio exercises and the resistance exercises, which I explained during my lecture, and yoga, tai chi, and general stretching. And you can see the pelvic floor exercises, which is one of the main things, the Kegel exercises and warm up and cool down exercises. These are all actually given very clearly, and most of the time exercises are actually more or less relevant to the normal people indications or the recommendations, but still there are some special concerns when it comes to the pregnancy. So the aerobic exercises, I'm not going to explain too much of these things because these being already told by many of my colleagues, and also with the other knowledge what you are already having it. The aerobic exercises is actually using large muscles with use of oxygen, and they are prolonged exercises but less intensity, and it has a rhythmic movement like you're walking, jogging, doing some aerobic dances, and all these things belongs to this category, right? So it has a very good effect on improve your body composition, especially if you really wanted to get rid of your unwanted fat, or if you really wanted to maintain your body composition. So this is the key exercise, and also it give you the cardiorespiratory fitness we all know. So we have a lot of other measurements like heart rate monitoring and all these things to measure these things, and this is the way of that you do the exercises. I think the sports doctors who know this very well. So there are some ways of gauging your intensity when you are doing an exercises, which is a very important thing. So if you don't have any kind of a smartwatch or any fitness, the calculators or a digital device to measure your heart rate, you can just use this very simple talk test, or we call it the rate of perceived exertion, the test, which I will show you in my next slide. So if you can just, if you're doing any exercise, if you're able to talk and sing, it's very mild for, right? So moderate is if you can able to talk but you can't sing. If you are doing a strenuous exercises, you can't talk and you can't complete a sentence or you can't sing. I mean, very simple but very objective, but most of the time it is accurate, right? So when it comes to this heart rate, our maximum heart rate is 120 by minus 120 minus your age. Out of that, if it is less than 64 percentage out of your maximum heart rate, it is mild, and if it is 64 to 76, it is considered as moderate, and if it is more than 76 percentage out of your maximum heart rate, we consider it as strenuous. So when you are doing exercises, if you are using your heart rate measurements using your the smartphone or a smart exercise or the sport watch, what you can gauge where you are, what is your level of or the intensity of exercises. Likewise, so it is very well defined, and this is the RPE values. You can just forget about this 20 marks scale, and you can come to the 1 2 3 4 like 10. And I mean, it's very obvious that you can, when you are doing any exercises, you can really say, you can really spot using this scale where you are. It depends, it's very individualized one, but it depends on your fitness levels as well. When you are starting your exercises, you might feel, even if you're doing a small exercises, you will feel somewhere here, but when you really you are adapted and you train well, and your intensity, the rate of perceiving will go down, but still we have a very rational and very simple and very accurate value, even it looks like a very simple. So this is the American College of Sports Medicine recommendation for aerobic exercises in pregnancy. So when it's come to this frequency, intensity, type and type, it's called the FIT formula, right? So you have a FITT. This is how you prescribe any exercises. So what we will do is, actually, we usually, even for the pregnancies, we ask them to do 5 days per week these aerobic exercises. So the intensity is the same, which it's a moderate exercises or the light exercises is advisable for them. Usually we do not advise them to do strenuous exercises unless they are kind of a as I showed you the lady, my second slide, who are like well trained to do that, and who are like the professional sports people, still they can manage their intensity level into a high level if there is no any other contraindications. So you can see these aerobic activities like brisk walking, stationary cycling, even swimming, right? And underwater walking. But here, instead of swimming, some people can do the underwater walking even in the swimming pool. But of course, some other developed countries, they have these treadmills, which is underwater treadmills. You can fill the water up to your whatever the levels that it's a treadmill is working. Yes, it's small device, small kind of a chamber, but treadmill in the bottom. You can just control your level and walk on it. And you can have the hand ergonometer. That is, you don't need to move your lower body. It's just like a paddling, like a cycle. You use your both arms to do the exercises. So you can go up to 30 minutes, 60 minutes up to, right? That is the recommendation is 150 minutes per week. Moderate exercises, that's more than enough. But as I mentioned, if you are doing any vigorous exercises, it is 75 minutes per week is enough, but that is only for special population. So second is the resistance exercises. If I go back and just show you this one, resistance exercises. So these are important things, but isometric exercises we do not recommend during the pregnancy. It's the isotonic and isokinetic exercises which we can impose. But most of the time, actually, the resistance exercises is what is the resistance? Resistance is the challenge that your body handle during any given task. I mean, if you like push, if you try to lift something, this is the resistance comes, right? So it's improve your muscular fitness, strength and endurance. It is anaerobic in nature and short duration exercises. So this is the American College ACSM guidelines during pregnancy. So it's again, we go by like this kind of fit formula like things, but it's a different thing. But frequency is 2 to 3 days per week. That is more than enough. Even 1 day per week also enough. But if you really wanted to get some positive effects, you have to go at least for 2 to 3 days. So you can do some of these exercises, 2 to 3 sets, which I explain when I go to the next slide, and 8 or 10 repetitions can be done. Like you can see here, calisthenic is the word that we are using to define the exercises that use your own body weight. Like for an example, if you are doing a squats, right, using your own body weight without any weights, or sit-ups or push-ups or wall squat or something like that, then that is the word that you are using, calisthenic. I'll show you some of the pictures, right? And free weights, we know all these very light dumbbells that we prescribe, a resistance band and gym ball exercises, which is specifically designed for pregnancy. I'll show you some of these. So remember, so you can do these exercises in between 3 sets. You can actually go for about 2 to 3 minute rest in between. And in normal resistance exercises schedules for a normal people, we advise them to finish it within 90 minutes. You should not go for 90 minutes, but in pregnancy you should confine it to just 60 minutes and stopping, right? So these are the gym ball exercises for pregnancy, right? This gym ball is, Swiss ball or gym ball is a very common instrument. Like it's cost about 4,000 or 5,000 rupees, and we can actually do these exercises. And there are different kind of exercises, like kind of a holding abdomen and breathing, and balance yourself. And at the same time, you can do your Kegel exercises, and these are the wall squats that you can keep your ball in between the wall and your back chest wall, and you just go down and come up. And some of the balance exercises, and of course the tummy exercises. And you can do all these the movements, and also some of the the very effective postures, and also to improve your lower limb muscles as well, just like one instrument which you can do many muscles in the body. You don't need to go for a gym. And even for normal people, this is one of the best exercises for females in pregnancy. So these are some of these. You can use the gym balls as well, and you can use some of your resistance bands to do certain exercises. And these are free weights exercises. You can see that this is called the kettle weights. This is like a kettle, because we have all these things even in our units. If anyone who interests, you can come and just inquire about us how we do these exercises for pregnancy or a normal person. So another important concept in exercises in pregnancy is a proprioception and balance. Why? Because of your body is becoming a differently shaped body when it comes to the pregnancy, because of the fetus. And that the shifting of center of gravity can, and due to the obesity, as well as due to the pregnancy, so sometimes there could be a imbalance problems comes when it's come to the when you are doing exercises. So similarly, so we actually promote them to do some of these balance exercises. So that's case by case. We do not strictly unlike in other populations go for this one, but that's again with the case. So stretching are one of the another important things, but I don't know how many of our pregnant ladies do this stretching. But even though their tendons or the ligaments become lax due to the pregnancy, the elastins and all these effects, but remember, like still you have to do many stretching exercises. This tailor sit and tailor press are very common and very highly advisable to stretching modes for especially for pregnant people. You can see that actually these things are like very looks to be very easy, but it's you have to really do it with the supervised protocols initially, and then you can really do it by yourself, or we can advise the patient to do it by themselves. So abdominal exercises are another the few exercises that the pregnant woman can do by themselves. So kneeling, pelvic and tilt. And here What they do is actually they don't allow their tummy to hang down. They just hold it like a brace, using bracing effect of their muscles, and they actually uh, move their spine just towards ceiling, and then it becomes straight, because it's something like similar exercises. We have the cat and camel, the position exercises, but this something different. So which we don't do a lot of, like spine C shape and going down like in cat and camel. But here what we do is actually straightening of the spine, and also you try to lift it towards the ceiling. It's like a C shape. But here standing pelvic tilt is a, you can really see where the your wall is there. So you just try to keep your body just touching first the back of the trunk, and also your buttocks at the walls, and then you try to actually tilt your pelvis until this entire body or the back of the chest or and the trunk touch the wall. So this is actually, you rotate your pelvis, and which actually give you a lot of the control in your core muscles, and also the pelvic muscles, to gain the strength, and also the abdominal the support. Actually, the research has showed, and they have to do it in a regular manner, and they showed that especially after the pregnancy, the hanging the this reduce the hanging of your abdominal walls after the pregnancy, because we know most of our females has this problem after the pregnancy, because their anterior abdominal wall is the hanging, and it's a big problem for them. And Kegel's exercises, which I wanted to highlight, actually this is one of the important exercises that people think sometimes this should be started just after the delivery or just before the delivery, but they said even in throughout the pregnancy, because this can be practiced by the the females who are having like their pregnancies. So actually, this has a very strong evidence, and also the proven that decreases the it actually most of the time what happens during the pregnancy, these problems are there, hemorrhoids and the decreased bladder control, the especially after the pregnancy, because most of the people, pregnant women actually come out with they have their very poor bladder control, and they tend to pass urine without the control. So that could be even some of the complications of the normal delivery. But even that, before, sometimes they might get this problem during the pregnancy because of the loading and the weakening of the pelvic muscle. So this has to be done uh, regularly by patients. So actually, how you do it, actually you can see the pelvic floor muscles. You know what is the pelvic floor muscles, and contract these muscles for 5 to 10 seconds, okay, and then relax and repeat for 10 to 20 times. How you do that? It's like that you try to you should have the feeling of you are urinating, but you try to stop the urinating in between, right? So this is the kind of the tip that you have to tell your patients how to do it, and make sure that you should, when you are before doing these exercises, the pregnant mother should pass the urine and empty her bladder, and then breathe normal during these exercises, and do at least few times per day. So this is important again, right? And yoga during pregnancy, so this is another area. So uh, I mean, yoga in pregnancy is somewhat different from the normal people, because some of these asana we call it the asana positions in yoga, it is not advisable to do in pregnancy, because we do it in a very supervised manner. We don't usually advise the patient to undergo by themselves. Even the people who has competent and doing regular yoga exercises, but again when they become pregnant, so it's a different form or different setting of exercises we advise. So there are some other few tips right? Avoid exercising in supine position when the POG is more than 10 weeks. So that's important. Avoid Valsalva maneuvers or isometric exercises, which I mentioned you. They should breathe leisurely and normally when they are doing the exercises, no Valsalva maneuvers, and should not exceed moderate fatigue point, especially when they are going the resistance or the strengthening exercises. As Dr. Yvonne said, it's a calorie intake and hydration is a very important thing. But remember, sometimes the exercises should not stop at the point of delivery. So there are postnatal exercises should be started just after the labor. So that's a different protocol. Even few hours later of your labor, you have to really go through. It's for normal labor, it's a different protocol, and for Caesars, it's a different protocol, which I'm not going to touch because of the time constraint. But we can discuss it, at any point. So this is our experience, right? So these are, I mean, all the pictures which I showed you in, maybe from the net or the standard protocol. But somebody might say that whether it's possible in our settings. Yes, of course, right? This was in teaching hospital Peradine when I was doing my registrar attachment in the sports medicine at Ginenows. So I started this program. We name it as a Pregnafit. So we had an extremely good outcome as well as very good participation. It's unbelievable because entire staff, entire pregnant woman took part in this mission, and you can see we did practically all those exercises which I showed you. Like these are the stretching exercises which I also involved, and also these gym ball exercises where Kegels with the Kegel exercises. These are the wall push-ups, and you can see these ladies are carrying the small dumbbells, and this is the kettle, and these are some of the stretching exercises and yoga like related exercises. We got down one of the yoga masters and we had a very good discussion, and we conducted yoga sessions for them. So you can see even the our midwives also took part, and they were also educated to do it, and this was actually a real success. All these the exercises, mats, all these instruments actually were donated by few companies, and we were very happy to do it. We have very good results, but unfortunately this was terminated due to the COVID. So this was 2019. So then the COVID came, and all the pregnancy ward was converted to halfway through for COVID patients, and we had but still we have some green lights. We are hoping to continue this NHK with and also with the other. Of course, we have our regional director of his consultant community physicians, which we can in future we can actually bring it to the outstation as well. So last my two slides, like sports and pregnancy, right? So again, so I don't need to explain anything other than that which I showed you almost evidence, right? You can see these sports can be done with cautions, bowling, cross-skiing, but most of these unfortunately we don't have in our life, but racket sports are there, like badminton, tennis and all these things, but we do it with caution. But basketball, cycling outdoors, but stationary cycling is allowed, not free cycling. You can see some gymnastic, rugby, and all the contact sports and martial sports, combat sports should not be done. So these, I just wanted to show you this video. Hope that it will work. Right. So these are the athletes that won Olympic medals whilst pregnant. Right. You can see because I mean, this has gone to a different level. Like a pregnancy is no more a disease or no more a thing that you should, remain a very sedentary life and in a cornered position, right? Which they think that is the big health problem in their life. Like I think even in the Sri Lankan context, I think we have to change this mindset of the female population, and these are all kind of the Olympic level, the female athletes who won medals. Actually, there are so many other participants who did not won the medals, but they took part in the the major competitions, right? So it's beautiful. Always like sports is always kind of a very dynamic thing. I'm not hesitate to show some videos and make you some pleasurable feeling. That's the beauty of sports medicine as well. So these are all actually the female. You can see even the some of females actually they play even the ice hockey, right? So I mean, actually, I went through a guidelines for pregnancy sports and physical activity, and they have gone through 5 or 6 countries because different countries has different perspectives of physical activity and participation on these different sports and physical activities. So we have to like in future we have to develop our own protocols based on our culture and belief and also the some of the scientific facts, right? So anyway, so this is about 6 minutes video. I'm not going to show you everything, right? Uh, okay, in summary, so exercise and physical activity during pregnancy should be started from prenatal period and continue as a lifestyle modification. So exercise prescription during pregnancy should follow the international guidelines, and in future like we have to have our own guidelines which is not been very well discussed as I mentioned you, but I think this is a in this Mother's Celebration Day, it's a good eye opener for us to think about again and talk about this topic as well. Thank you.